Welcome to Talk 1260 KTRC, the Humanity Behind the Vanity. It's a show about plastic surgery and lots of other things. I'm Dr. Daniel Ronel. This is Betsy Ronel, my wife. Hello.
How you doing?
How you doing? All right. So we got a tip coming up from Dr. Rita Dodge.
Yes.
But before that, you read something you wanted to talk about.
Oh, okay. This is in this month's W magazine. It's, I don't remember the name of the article, but it shows a melted Barbie, or melting Barbie. It's kind of funny. And it's about plastic surgery. Too young, too much. When is it too young and when is it too much? And the fact that in major cities, essentially really just LA and New York, that young kids are getting Botox. You know, these are teenagers I'm talking about, not even college-age kids. Botox, fillers, and they end up looking, you know...
Older.
Right, like they're 36 was the age that a lot of these doctors in the article gave. And, you know, they felt it was sad that this is what's happening. It used to be, in the old days in New York City anyway, where I grew up, that when you turned 16, for your sweet 16, you either got a boob job or a boob reduction or a nose job if you had a big nose. Yeah, or for high school graduations. That was considered very nouveau, riche kind of behavior and really kind of obscene even back then. But that's what some of these city parents were giving their daughters for and their sons nose jobs in terms of that for sweet 16s or graduations from high school, and you know it was considered really vulgar. Now they've upped the ante.
Yeah, I mean there's plastic surgery is so much in the media, and teenagers so much want to look like older adults, and they emulate the people that they see on TV. And we talked about this before, you know, there are procedures that are okay for teenagers, but the Botox and the fillers, and even breast augmentation, they're just way too young. That's my opinion.
Right.
And you know, for some people, they may think differently. They may have a teenager who's quite mature and who, you know, says, I want to have this wrinkle gone, or my cheek muscles thinned, for example. That's something that's been in their news recently.
Oh my goodness. And a child. I mean, these are children. They don't even vote. These are children. Babies.
It just seems a little too much. And why? The question is why? Is because this is a choice that's being driven by, you know, external stimulation. Okay, it's sort of not a natural choice that they're making. And I'm not sure that teenagers are mature enough to understand the risks and benefits of a procedure. If I were to speak to, I had a 13-year-old recently in my office, and I took a nevus off of her eyebrow.
Nevus is what?
A big mole off her eyebrow. It was causing her a lot of, you know, consternation.
That's understandable.
Okay, but my point is, I was trying to explain to her, this is what's going to happen, this is how you're going to heal, you have to stay out of the sun. And she was just giggling and laughing, and you know, and the parents were obviously the ones to whom I spoke, because the mom was in the room. But how could you? I couldn't even imagine giving her Botox, for example.
Why would you want to? I mean, that's the age when you have your collagen and your baby faces and your
I don't see
roundness.
board-certified plastic surgeons doing that. I think it's people who, you know, want to make a living, and they have the ability to do it, and perhaps they have more blurred ethical standards.
I know plenty of people in New York City who, you know, these are very rich people, new money, and you know, they're like, okay, shut that kid up. Here, go get your nose fixed, go get your boobs done. You want filler, you want big lips like Angelina Jolie? Here, baby, here's your money. I mean, that's the way a lot of kids in New York City were raised. I mean, when I grew up, I'm sure it's far worse now. But, you know, like I had a bump on my nose. I broke my nose 2 times. Once when I was a very young child, and then once, no, I was older when I broke it the second time. Once it's like a 10-year-old, and then once when I was 25. But anyway, my nose never grew in right. And it was fine, but it always bothered me. And I begged my father to get me a nose job. Please, all I want to do is chop off the little bump and make it straight. It had a small bump, and it was slightly crooked. And it really bothered me. But I thought that I was very pretty, despite the nose. And no one ever said, oh, you have a big nose. Bleh. They never really made fun. One kid did, but he had some other issues going on. So that was his problem. I called him out. Anyway, but you know, so that was it. I never really went through.
So you never had it?
What? So I never, my parents
yeah.
would my parents were very conservative. They would never have allowed me to do that. They're like, absolutely not. You know what? When you're older, in your 20s, if it's still bothering you or if it's worse, then you're an adult. You can make your own decision. You can pay for it yourself, and it'll be all on you. You're young. You don't even know who you are. You know, don't change yourself yet. We understand that this is upsetting to you, but don't touch a thing. Just wait. And I think, even though I didn't like that answer, I waited. I mean, I never had a problem getting boyfriends. I always had, you know, plenty of friends. I was the prom queen, the homecoming queen.
I just wonder what the what do the parents of these teenagers who are getting Botox or fillers, and I don't think it's a lot of, I don't think it's a trend. Just because it's in the news doesn't mean that it's in the trend.
W Magazine happens to be a very reliable source for this kind of stuff, and as far as New York City goes, I can guarantee what's going on in every beautiful private school in New York City.
So what do the parents do?
Parents don't care.
Don't care.
This is why my parents, I went to high school in New York City, but I lived in the suburbs. My parents did not want anything to do with that kind of person who would let their children mutilate themselves like that.
Yeah.
They just found it so offensive.
It's not mutilation.
Okay.
But still,
you know what I mean, sorry.
Right.
But, you know, for a child, who knows? And the thing is these rich kids, they can save up $850 for a syringe of Restylane. It ain't no thing for them. They don't even, the thing is wouldn't they need adult consent?
Yeah, that's what I don't understand. So
right.
the parents have to be present.
Yeah.
For somebody.
Or a maid or a nanny
license,
or somebody.
Right.
Yeah. I mean, they don't take anybody.
Right.
They'll pay their nanny. I mean, this is what kids do.
That may be
They
what they
pay
do,
their
right.
nanny. They'll say, "Here, I'll give you $200." You know, or this, or they'll threaten them with. I mean, this is what these kids do. I mean, it sounds like a movie, but there was the Nanny Diaries, which was actually quite accurate. But there's a lot of just, you know, the children aren't raised by their parents there. You know, so this is what goes on, and I think it's really sad.
Yeah.
But, you know, we have 2 minutes left, so we can ramble on for a minute about this. But then I'll get into, like, the more, which we've gone over before, but there are medical issues that go along with, actually, right. We'll talk about that in the next segment. But, yeah, I mean, how young is too young? Should a 15-year-old with thin lips, noticeably thin lips, be coming to a plastic surgeon or dermatologist saying, I want my lips to be larger? I say no. Yeah. Right?
Yeah, I say no. Now, if it's somebody who, like I recently did, somebody who's going to college, she's going away from home, she's going to live by herself, she's always had, this is Elizabeth who used to work in her office, she's always had terribly thin lips.
I saw her, she looked fine.
Yeah, probably after I did her lips.
No, I saw her before.
Okay, well,
she looked fine.
Okay.
I know it's her personal decision.
But she's older. Yeah, she's young. But
she's older. She's not 18. She's older.
Right, she's older. She's going to college. She's emancipated.
No, when you go to college traditionally when you're 18. She is someone who's going to college a little bit later, so she's more of an adult.
But she's very young, but still able to make a decision for herself.
Right, and her aunt works in the office. So,
right, somebody who's living at home, you know, really 15, 16. I don't think you can put an age on it. There may be some emancipated minors who are 16 or 17.
Okay, fine.
But I think it has to do with their maturity level.
Yeah, I mean, I knew some emancipated minors in New York City. They lived in their own apartments, had their own driver, and whatever. They were nuts. They were doing drugs, drinking, I mean, you know, sleeping around. They had no business. They did not get any kind of plastic surgery, these particular few I'm thinking of, but that's just sick. I just think it's wrong.
Okay, well, I agree. So anyway, we'd love to hear your comments, so if you want to email it to us, that would be great, and then we'll read them on here.
All right, we'll be right back after Dr. Dodge.
Yes, thanks for listening.